We will call to order the House Health Subcommittee. It is Tuesday, March the 5th, 2024. Ms. Adams, if you could please call the roll.
Representative Hicks. Representative Jernigan.
Yep.
Representative Leatherwood. Representative Martin.
Here.
Representative Mitchell.
Here.
Representative Sherrill.
Here.
Representative Terry.
Here.
Representative Williams. Chairman Hawk.
I am here.
You have a quorum.
Chair detects a quorum. Thank you very much. Any personal orders from any members before we begin today? We'll take a bit of personal privilege. It has been the Doctor's Day on the Hill and physician students' Day on the Hill as well. If you're one of the Doctors' Day on the Hill, please stand up. We'd like to recognize you. Thank you for being here. If any of us get sick, we'll know exactly where to go. So thank you all very much. Ladies and gentlemen, we do have a calendar before us, and we're going to go expeditiously as we can. It is a substantial calendar, and we're going to go as quickly and as efficiently as we can. We're going to start off with item number 1 on our calendars. Item number 1, House Bill 2773 by Leader Cochran. You have a motion. You have a second. You're recognized, sir.
Thank you, Mr. Chairman. Also have an amendment if we want to put that on now.
All right. We are working on amendment. Drafting code is 013667. Is that accurate?
That's correct, Mr. Chairman.
All right. Have a motion. We have a second on your amendment. Let's go ahead and put the amendment on the bill so we can discuss in its proper form. All those in favor of placing amendment drafting code 013667 on the bill, please signify by saying aye. Any opposed, please say no. The ayes have it. Your bill is amended, ready for discussion. Please tell us what your bill does.
Thank you, Chairman and Committee. And House Bill 2773 simply makes it clear that in Tennessee code that a parent has access to a minor's prescription records if they contact a physician and want to know what their child has been prescribed. They can have access to that. Another big part of this legislation is essentially a duty to warn a minor's parent or guardian if the minor is having suicidal ideations, if they're being treated by a physician and the physician detects that they warn the parent. And I will yield to any questions.
Thank you. And you have expressed to many of us that this comes from a very personal constituent situation that is certainly tragic for all of us that have heard the story. So,
yes, sir.
You've heard the explanation of the legislation. Do we have any questions or comments for the sponsor? Okay. And we're going to kind of be coming and going as the meeting goes on. Hearing none, are you ready to vote? Representative Mitchell, you're recognized.
Yeah. How's the medical community on this piece of legislation?
Sure. And again, I've spoken to various members of the medical community, and I'll tell you that one had a meeting with a psychologist, and one particular section of code that this addresses is 338202, which that section in Tennessee code currently treats an emotionally disturbed 16 or 17-year-old basically as an adult. And so the first thing the psychologist said to me was, well, really, when they read the entire bill was, look, this is really kind of our standard of care already. And I said, but if you look at these other sections of code, that there's some gray area. And I pointed that one out specifically. And so when she read that, she said, I don't know why that section would be there. And she said, specifically a 16 or 17-year-old who's emotionally disturbed is exactly who you would want parents involved in that. And so she was going to speak to other psychologists to see if they were aware of any, and I have not heard any reason from other psychologists why taking that out would be a bad thing.
Yeah.
You recognize Representative Mitchell?
Yeah, I think the duty to warn, I don't have that much problem with, because I think we've had other pieces of legislation that are similar to that already this year. And just the prescription records, I think, the privacy issues there, and especially I think the docs may not be too much in favor of that. All right. Thank you.
Leader Cochran.
Thank you, Chairman. And I'll just and to that point, right? And so if I think the concern there is that it might, if it would prevent someone from getting care, but the important thing to note with this bill is that this does not touch consent in any way. It just allows your parent to have access to prescription records because, ultimately, if a child is injured and the ambulance comes to pick them up, the paramedics are going to ask the parent, hey, what medications are they on? What's their medical history? So it's just allowing that access. It's certainly not requiring consent, just allowing access.
Thank you. Chairman Williams, you're recognized.
Thank you, Leader Cochran. I think this bill is extremely important. As I have 2 teenage kids of my own, I can't imagine not being able to understand or know really what's going on as relates to their mental health care. I know this emanates from an experience that you had in your district where a parent was not notified of the meds that their parent is on. And I know this is the health subcommittee, but one of the biggest challenges we face in healthcare is people not taking their meds. And so if a parent doesn't know that their child has to be on a certain medication, then it's not in the child's best interest. In this case, it is still a child. In a lot of cases, the parents are the ones who's paying for the counseling services that are going there, much like many of us had or have done. And so I appreciate this bill. I think it's important that the parents do know so that another parent doesn't have to face what your constituent did in knowing after the fact. Sure. And so I appreciate you carrying this bill and look forward to seeing it pass.
Thank you.
Thank you. Chairman Jernigan, you're recognized.
Thank you. This bill really is, I think, is more so about notification, I would think, because right now, if a parent went to a pharmacist, from what I understand, and said, I want a list of my prescriptions and my children's prescriptions, they would hand it over to them. So it's really about notifying so when the parent can know when to go down there and ask for that. Would that be accurate?
Thank you, Mr. Chairman. So nothing in this bill requires the physician to report on the prescription portion. The only requirement for reporting in this bill would be for the suicidal ideations. Right. But the way that this is written actually does not even require the physician to immediately call the parent and say what they were prescribed. But it would at least, it gives that parent the right to call and see. And I guess one important area that this would cover, and Chairman Williams kind of touched on it a little bit, you might not have even filled the prescription, right? So you might have gone to a minor might have gone to a psychologist, and they might need medication for bipolar depression, and they just don't want to take the medication. They might have been prescribed it, but they never actually went to the pharmacy to fill it. This actually would at least give the parent the ability to say, hey, were they prescribed anything? Because it might be a situation where the parent needs to make sure that their child is right. taking medication.
So
you recognize?
I think I'm right. So the notification of harm is what we're really getting at, because I believe right now so once they get that, they'll go down to the pharmacist and ask for the list and give it to them. So I think it's clarifying. I like the bill. That's good.
Thank you. Any further questions or comments? Are you ready to vote? All those in favor of sending House Bill 2773 as amended to full health committee, please signify by saying aye. Aye. Any opposed, please say no. The ayes have it. Your bill moves forward.
Thank you, Chairman and committee. I appreciate you.
Thank you very much. We are now on item number 2 on our calendar. The request has been from Chairman Reagan, House Bill 2647. We are to roll that bill 1 week. Again, item number 2 on our calendar is House Bill 2647 by Reagan, rolled 1 week without objection. We are now on item number 3 on our calendars. House Bill 2086 by Chair Lady Helton Haynes. The request again has been to roll this bill for 1 week. Without objection, we will roll House Bill 2086, item number 3 on our calendars by Chair Lady Helton Haynes for 1 week without objection. We are now on item number 4 on our calendars. Chair Lady Carringer. Chair Lady Carringer. Item number 4 on our calendar is House Bill 2366. Do we have a motion? We have a motion. We have a second. You are recognized, Chair Lady.
Thank you, Chairman, and thank you, committee.
Do you have an amendment?
No, we do not.
All right. I'm seeing an
Here.
amendment drafting
Let's see, wait a
code
minute.
014205.
Yes. Okay. Yes, it was something that got changed right at the last minute. There was a wording. Yes, I'm sorry.
We have a motion. We have a second on House Amendment Drafting Code 014205. Let's go ahead and place that on the bill so we can discuss it in its full tenor there. All in favor of placing Amendment number 1, Drafting Code 014205 on the bill, please signify by saying aye. Aye. Any opposed, please say no. All right, your bill is amended. You're open for discussion on the bill.
Thank you, Chairman and committee. So this was brought to me by Tennessee Academy of Family Physicians. And right now, current state law allows physicians who graduated from a U.S. medical school to obtain a Tennessee medical license after their first year of residency training, but requires international medical graduates to complete a full 3-year training program. And we're talking about their residency programs before becoming eligible for licensures. In terms of moonlighting, this strictly has to do with moonlighting. After the first year of residency, U.S. medical students can go and moonlight after their first year to make additional income, where foreign medical students cannot. They have to wait till they finish their full 3 years of residency. The reason for bringing this is that anyone that's in a USA medical residency program, they have all taken the same steps. Medical board, step 1, step 2, and all to get into residency, the same requirements are required. And so this is just to hopefully maybe help with some of the shortages with physicians, that they could also moonlight after their first year. So with that, I'll stand for questions and ask for your support.
Thank you. We've heard the explanation. Do we have any questions? All right, question has been called. All those in favor of sending House Bill 2366 to full health committee as amended, please signify by saying aye. Aye. Any opposed, please say no. The ayes have it. Your bill moves forward.
Thank you so much.
Thank you, Chair Lady. We're now on item number 5 on our calendars. Call up item number 5, House Bill 2212 by Chairman Haston. Chairman Haston, you have a motion. You have a second. You're recognized, sir.
Thank you, Mr. Chairman and Committee. This is a bill to protect rural hospitals and help improve reopening opportunities for failed or abandoned rural hospitals. It does this by authorizing the comptroller to put in protective measures and to investigate the operations of rural hospitals that are at risk of failure or abandonment. To summarize, this bill is about creating responsible management and reopening capabilities of our rural hospitals. With that, I'll be glad to answer any questions.
Thank you. I will ask a quick question. Is this bill from the comptroller? Is this one? I know we had an administrative bill recently that dealt with financial reporting of that last year should a hospital close and some information therein. Did this come from the comptroller?
This is not a comptroller bill. It is something that came from an organization in my community that have had some success reopening some of these rural hospitals. But I haven't talked. The comptroller hasn't come to me to talk about this bill.
Okay, thank you. We are on House Bill 2212. Any questions, comments for the sponsor? Okay, hearing none, are you ready to vote? All right, all those in favor of sending House Bill 2212 to full health committee, please signify by saying aye. Any opposed, please say no. If you'd like to be recorded as a no, please tell the clerk. Chair detects a favorable vote. Your bill moves forward.
Thank you.
House Bill 2212 will move forward to full health committee. All right, ladies and gentlemen, we are now ready for item number 6 on our calendars. It is a Senate Joint Resolution 160. It is going to be carried by Representative Davis. Representative Davis, do we have a motion? We have a motion. You have a second. You are recognized.
Thank you, Mr. Chairman, and thank you, committee. And what this Senate joint resolution does is it expresses a commitment to the quality rehabilitation services for persons who are blind and urges the Department of Human Services to collaborate with the National Federation of the Blind of Tennessee to develop a plan for establishing a facility that provides comprehensive on-site facility-based vocational rehabilitation services that allow the individual who is blind to be totally immersed in that training experience. And I believe we have someone here, Mr. Brown, to testify.
Yes, we certainly do. We have an individual, James Brown, who would like to speak on the legislation. We will go out of session at the moment. We're out of session. Mr. Brown, if we could work to get you mic'd up there, we will allow you to introduce yourself. If you could tell us who you are, who you're with, and we've got a limit of 3 minutes in your testimony. Mr. Brown, you are recognized.
Thank you, committee. My name is James Brown, and I'm the president of the National Federation of the Blind of Tennessee. I debated on being very critical of the Department of Human Services, but I don't think I'm going to do that today. I do want to tell you that I know thousands of blind people literally around the country as a part of a national organization that also has a huge footprint here locally. I know scientists who are blind who work on an oil rig in the Gulf of Mexico. I know blind television producers. I know a blind guy who climbed Mount Everest. But I also know blind people who can't walk independently to their mailbox. And two of the major reasons for the difference in those two categories of blind people, other than aptitude, which is true for all of us, two main differences are this: the level of blindness training that is offered to a person. We're talking about learning how to read and write Braille. We're talking about how to use technology. We're talking about learning how to cook and clean. We're talking about those kind of basic life skills, using your cane, using a guide dog, knowing how to get around in the world, but also believing in the capacity of blind people. And the blind people of Tennessee are urging this committee, imploring this committee to pass this resolution. Appreciate you very much.
Thank you very much. Appreciate your testimony. Any questions or comments? Hang on just a second, Mr. Brown.
Yes.
Chairman Jernigan, you're recognized.
Hey, James, it's Darren. How are you?
I'm doing well, sir. How are
Yeah,
you?
good. Are you all looking for maybe a separate facility or just even an area in a building that's dedicated to training?
So for the past 70 years, Tennessee had Tennessee Rehabilitation Center in Smyrna. In some form or fashion, that blindness training center existed. Back in 2019, the process of dissolving that training center began. Really what we're looking for, because the Department of Human Services has told us they are not interested in a state-run center, which was what TRC was. We are interested in establishing an independent center that is essentially funded through Voc Rehabilitation and basically funded by services rendered. So Voc Rehab, the Division of Vocational Rehabilitation Services, already pays for people to go through blindness training. Right now, they're shipping them out to places like Colorado, New York, Louisiana, Massachusetts, all over the place. And we really want a place here at home where we can have blindness training. So someone who's recently went blind and really is leaning a lot on their family in that time to be able to have a place closer to home to go. Mississippi has 2 training centers. Alabama has 2 training centers for the blind, but for some reason, the Department of Human Services believes that Tennessee doesn't need one.
Chairman Jernigan.
So it would also be appropriate for, I guess, those that are recently graduated from the Tennessee School for the Blind to go to a training center afterwards, correct?
Absolutely.
Okay, well, I fully support this resolution. We have a lot of inventory in real estate in this state that we can find one spot to put you all in. Appreciate it.
Thank you.
Thank you. Representative Sherrill, you're recognized.
Thank you, Chairman. Thank you for being here today. I was just curious about,
So sorry.
out in the Donaldson, Stewart's Ferry Pike area out there, don't we still have the School of Blind out there? I know there's a building out there.
We do, and that is actually in Representative Jernigan's district. Yes,
Okay. Are we still helping people that's blind at that place?
we do. However, that is for people who are, in elementary school, middle school, high school. But lots of times people need training. People go blind early on in life, or people actually get through places like Tennessee School for the Blind without really, really good training. So they need some extra training as they get through with high school.
So, adult like you, they don't do any training there for you or others.
That's correct.
Okay.
Yes, sir.
Thank you.
Thank you. And Mr. Brown, before you go, if I could, you are with the National Federation of the Blind of Tennessee. Is that accurate?
That's correct.
How many organizations advocating on behalf of blind folks do we have across the state of Tennessee? Are you aware of the number of different organizations?
Well, I'm going to say it's probably difficult for me to say, but there are probably three main advocacy organizations. You have the Tennessee Council of the Blind, you have the National Federation of the Blind of Tennessee, and then you have the State Rehab Council. And those are your three main sort of organizations, and all three of those organizations are for this resolution.
Okay, that's very helpful. And I know as we've looked on other issues and potential facilities of this nature, has there been talk amongst the organizations of raising funds, potentially raising funds and creating some type of a center location?
Yeah, we have talked about raising funds. That process has already begun. There is also a process through the RSA, Rehab Services Administration, through the federal government, what's called an establishment grant, which sets up a period of 4 to 5 years where the federal government, for example, in the first year would pay for 80% of the program, and the state could match that by a 20% mark. And so if we wanted to purchase a building, the federal government would pay for 80% of that in the first year. And I think it goes down every year until about 5 years when there is no match by the federal government. But that allows you to establish a center to pretty much get up and going, purchase your building, purchase all the, some of the things that are involved, like just a Braille display for me to bring in here and read my notes in Braille electronically would be anywhere from $3,000 to $7,000. And so a lot of the equipment is expensive, and that would allow a lot of startup costs for that venture.
All right, thank you very much. Any further questions or comments? Mr. Brown, thank you very much for being here.
All right,
Appreciate your advocacy
I've
work.
got to testify to another committee, so I appreciate everybody.
You go get them. Thank you so much.
Okay.
Thank you.
We are
right
back
over.
in session now. All right, ladies and gentlemen, any questions or comments of the sponsor? Questions been called. All those in favor of sending Senate Joint Resolution 160 to full health committee, please signify by saying aye. Any opposed, please say no. The ayes have it. Your resolution moves forward.
Thank you, Mr. Chair. Thank you, committee.
Thank you. We're now on item number 7 on our calendars, House Bill 2296 by Chairman Whitson. You have a motion? You have a second. We are also looking at amendatory language on your bill, Chairman Whitson.
Yes, Mr. Chairman, and I show that as 014962.
All right. You have a motion. You have a second. Again, we're voting on placing amendment drafting code 014962 on the bill for full consideration. All those in favor of placing the amendment on the bill, please signify by saying aye. Aye. Any opposed, please say no. The ayes have it. Your bill is amended, ready for explanation, sir.
Okay, thank you, Mr. Chairman. Thank you, committee. This is a fine-looking committee you have, Mr. Chairman. Just want to let you know. Committee, this bill was brought to me by the Tennessee Marriage and Family Therapist to clean up the code dealing with licensure portability. Both licensure by endorsement and reciprocity for marriage and family therapy is currently in statute. With the endorsement process, marriage and family therapists licensed in another state can become licensed in Tennessee as long as they meet Tennessee's qualifications. The demand for mental health services in the state is extremely high. Marriage and family therapists can assist the families in the state as they deal with multiple crises. Tennessee currently ranks 46 in the nation for mental health providers per capita. We already have the process for other counselors, and we have shown that we, as a General Assembly, are committed to increasing access to mental health care. The marriage and family therapists will still pay full licensure fees to the state, and our state board will have oversight of their license, including disciplinary action. With that, Mr. Chairman, I renew my motion.
Thank you. You've heard an explanation of the legislation. Do you have any questions? Questions or comments for the sponsor? Question has been called. We are on House Bill 2296 by Chairman Whitson. All those in favor of sending the bill as amended to full health committee, please signify by saying aye. Any opposed, please say no. The ayes have it. Your bill moves forward.
Thank you, Mr. Chairman, and thank you, committee.
Thank you. As we've mentioned, we've got several members that are coming and going today. Item number 8 is by Representative Martin. He has had to step out of the room, so we will roll his bill, which will bring us to item number 9 on our calendar, House Bill 2327. You have a motion. You have a second. Representative Freeman, I think we've got an amendment on your bill language as well.
Yes, sir. Drafting code 13982.
Again, ladies and gentlemen, we have amendment drafting code 013982. Let's go ahead and put that. We got a motion. We've got a second. All those in favor of going ahead and placing the amendment on the bill, please signify by saying aye. Aye. Any opposed, please say no. All right, your bill is amended. For explanation, Representative Freeman.
Thank you, Chairman. A few weeks ago, many of us had the opportunity to meet with the Foundation for Suicide Prevention, talk about the work they do. One of the things that they talked about when they met with me was the annual report that the health department does on suicide prevention. It breaks down different demographics, causes, and makes recommendations on how to prevent. My initial bill as drafted has been changed a bit after working with the Department of Health and finding out that they already present or prepare this report. It used to be codified that it had to be done annually. It's not. They now just do it. This would codify it and make it mandatory that it's created annually, and then they would share the report with the committee. In Tennessee, we lose about 3.3 people a day to suicide. Suicide rate in Tennessee is 17.5 per 100,000, which is 25% higher than the national average. I would wager that everybody on this committee and likely everybody in this room has been touched by suicide at one point. What my hope with this is that we get the data presented to our body, to the legislature, so that we can have it front and center, so we can make meaningful impact to try and prevent suicide in Tennessee. And with that, I stand ready to answer any questions.
Thank you. Questions or comments for the sponsor? Chairman Leatherwood, you're recognized.
Just curious, I see as part of the report, it would include age, race, ethnicity. Would sex or gender be required to be included as well?
So it's already in the report. They already do it, breakdown by sex. Thank you for the question.
Thank you for the answer. I think this is compilation of some information. Have you given us some statistics? This is compilation of some information that we have been gathering and creates it in a informative report is basically the request. Question's been called. Seeing no objection, all those in favor of sending House Bill 2327 as amended to full health committee, please signify by saying aye. Aye. Any opposed, please say no. The ayes have it. Your bill moves forward.
Thank you, Chairman of the Committee.
Thank you. All right, we are now ready for item number 10 on our calendar, House Bill 2822 by Leader Camper. The request from Leader Camper's office has been to take this bill off notice. Without objection, House Bill 2822 is off notice. We've got some members in the committee wanted to pull a bill or two up. We've got some that I think the committee can dispose of fairly quickly that we're going to go ahead and take care of quickly, and then we'll get to a member whose bill might take a little bit longer. So we're working on that. We're now pulling up item number 11 on our calendar, House Bill 1853 by Chairman Williams. Chairman Williams, do we have a
Thank you. Thank you, Chairman and members.
Do we have a motion? We have a motion. We have a second. You are recognized.
Thank you, Chairman and members. This bill was brought to me by a rehab facility. What current practice is, I had a constituent who suffered a stroke from my district, and she had to have physical therapy because of her stroke. And currently, what would happen with her is she would have to leave her room in long-term care facility and travel approximately 25 yards down to a therapy center in order to get physical therapy for the day. And then she would have to return because the physical therapist or occupational therapist in her situation didn't have a home health license, which would be required if the actual practitioner came to the room. And so what this bill would do, it would allow for those therapists, physical therapists, occupational therapists, speech therapists, in the instance of an assisted living facility or some of such nature that they wouldn't have to go and acquire a home health license just to be able to provide the same services in that facility because of the room that they're in. That's and we have support from all the practitioners about it. It's just better for patients if the therapist can come to their room in a lot of cases. With that, Mr. Chairman, I'm happy to answer any questions the members might have.
And thank you, Chairman Williams. I think we've got an amendment that helps to clarify that as well and adds to the legislation.
Yes, sir. My apologies. I forgot about
No,
that.
none at all. I think we're going to entertain now House Amendment number 1, drafting code 014724. Is that accurate?
That is correct.
Got a motion. We got a second. Let's go ahead and put the amendment on the bill. All those in favor of placing amendment drafting code 014724 on the bill, please signify by saying aye. Aye. Any opposed, please say no. All right. Your bill has been amended and has been explained.
Thank you. I renew my motion.
All right. Question has been called. All those in favor of sending House Bill 1853 as amended to full health committee, please signify by saying aye. Aye. Any opposed, please say no. The ayes have it. Your bill moves forward. All right. Thank you. We are now on item number 12 on our calendar. House Bill 2254 by Representative Love. You have a motion. You have a second. Any amendments on your bill, sir?
No, sir. Thank you, Mr. Chairman.
All right. You're recognized for explanation.
House Bill 2254 adds 3 members to the Child Fatality Review Team. The Child Fatality Review Team was created in 1995 as part of the Child Fatality Review and Prevention Act. It adds 3 members to that board and also has the report from that team to go to each LEA and the board of the Tennessee chapter of the American Academy of Pediatrics. And that is simply what the bill does, Mr. Chairman and members.
All right. Thank you. You've heard explanation of the legislation. And thank you, Representative Love. You and I have worked very closely on a lot of issues. What brought this bill to you? What's the genesis behind the legislation, sir?
Had conversation with some of the mothers from Covenant School about how they might enact legislation and wanted to make sure that parents were actually on the review team. And that's what brought this legislation about.
Thank you.
Yes, sir.
All right. You've heard explanation. Any questions or comments of the sponsor? Question has been called. All those in favor of sending House Bill 2254 to full health committee, please signify by saying aye. Aye. Any opposed, please say no. The ayes have it. Your bill moves forward.
Thank you, Mr. Chairman and members.
Thank you. All right. Now we're going to take a little bit of a pause. We've got some action on a couple of bills here. Item number 13, House Bill 2422. The request from Representative Shaw has been to take this bill off notice. Without objection, the bill is off notice. We are now on item number 14 on our calendar, House Bill 2555 by Representative Shaw. The request has been to roll this to our last calendar, by the way, which will be on March 19, for those of you keeping a scorecard. So House Bill 2555 will be rolled to the last calendar without objection. We are now going to item number 15 on our calendar, House Bill All right, with discretion from one of our members, we are going to, at this juncture, we're going to go to item number 17 on our calendar. We're going to jump a couple of bills here. We're going to go to item number 17 on our calendar, House Bill 2816. We have a motion. We have a second. Chairman Faison, you are recognized. Do we have any amendments that you'd like to put on as we go forward?
Yes, sir, there is an amendment.
Okay, I'm seeing amendment drafting code 013789.
Yes, sir, that's it.
Okay. In order to have a full discussion, do we have a motion and a second on the amendment? We have a motion, we have a second. Let's go ahead and place the amendment on the bill so we can have a full, robust discussion on the legislation. All those in favor of placing amendment drafting code 013789 on the bill, please signify by saying aye. Aye. Any opposed, please say no. The ayes have it. Your bill is amended. You are recognized on the legislation, House Bill 2816. Chairman Faison.
Thank you, Mr. Chair, committee. Very good to be with you. Over really maybe the last 10, 15 years, there's been a change in how children are able to do things with their body. We've seen surgeries come where a child can change their sex. State of Tennessee stopped that last year. This bill doesn't really deal with what children have done or are going to do. What this bill does moving forward is provides a pathway that if a child has gone through a transgender surgery, gone through change hormone treatment, this provides a pathway that if the state has anybody subsidy, any provider for the state has done that they in turn are now going to help them on the back end. The reason that I'm bringing this bill today, and you're going to meet one of my friends, this is what I've seen as I see this. There are children who get into this young, as 12, 13 years old, and decided that they need to change their identity, their pronouns, who they are. After they go through that, when they do that, they are automatically met with a sea of support. Individuals from all over will rally behind them and love them and nurture them and affirm them and just offer them care like you can't imagine. But what we've seen and what you're going to hear today in testifying is that as they grow and mature and they decide, you know what, maybe I might not have made the right decision. Maybe I want to be what I was born with biologically. That sea of support, that army of individuals who are there loving you, affirming you, all of a sudden disappears and will oftentimes end up bullying and abusing and kicking you to the curb. And then I also see when they do that and they've gone through change, a lot of times those of us on the right who are kind of more in traditional values, we don't really know what to do. And there's still a shun from those of us on the right. I'm hoping that the state of Tennessee will provide a platform that we receive people. And if they feel like that they have made a mistake, that we offer them a way to correct that mistake. And with that, Mr. Chair, we do have people here to testify, and if y'all are good with that, I'd just soon step out of the way and let them talk.
Thank you very much, Chairman Faison. We do have some folks who would like to testify on the legislation. We have with us today Chloe Cole, Miriam Grossman, January Littlejohn, who would like to speak in support of the legislation. If you all would like to come forward, take a seat at the table. We'll make sure that your microphones are on. And if you could indicate who you are, who you're with, and tell us what you'd like to know. In the onset of the comments, we are going to limit those to 3 minutes in the beginning. We will give time for questions and answers afterwards. We are in recess. And please introduce yourself. Tell us who you are, who you're with, and what we can do for you.
Thank you, committee members. My name is January Littlejohn, and I was born in Memphis, Tennessee, so it's great to be back with you all in my home state. I'm a licensed mental health counselor and a parent advocate with Do No Harm, and I'm here today to explain why this bill is necessary. In 2020, at the age of 13, our daughter told us she no longer felt like a girl and began to identify as transgender. My husband and I chose a path of therapy to affirm our daughter and the reality of her sex and work to resolve her co-occurring mental health issues. She is now desisted in her trans identification and is thriving, although she grieves the years she lost to the trans identification. I am grateful to know that Tennessee parents will have the right to this evidence-based mental health care for their distressed children, because unfortunately, this is not the case in every state. Over the last 3 years, I have spoken to hundreds of parents with trans-identified children and detransitioners. What you will hear from Chloe is not an isolated case. There are thousands like her, each experiencing negative health issues or complications from the hormones and transition procedures they underwent. Many still have unresolved mental health issues such as sexual trauma, eating disorders, autism, depression, and anxiety. Those who do seek medical advice for discontinuing hormonal therapy are told there is no protocol or standard of care for the process of detransitioning. Detransitioners also report it is challenging to find doctors who are willing to treat their unique adverse effects from the hormones and surgical complications. There are currently no dedicated medical billing codes for detransition procedures, but that is only part of the challenge in getting insurance to cover their care. There are also health insurance companies that explicitly exclude any procedure or surgery that seeks to restore their bodies from the medical harm they have endured. It is unacceptable that insurance companies will pay for their transition, but not cover the repair of the adverse health effects resulting from these procedures. These vulnerable individuals tell me they feel like they have been lied to and abandoned by the medical and psychological community, which has led to a deep mistrust of these institutions. Most detransitioners experience a great deal of shame and regret from the medical trauma they have endured. Their shame often turns to despair and hopelessness when they can't access the reparative care they need, and I have serious concerns about the long-term mental health of these individuals. This legislative reform is desperately needed to help these detransitioners, many of whom were misdiagnosed and disfigured by the doctors they trusted and are now suffering in silence without help.
Ms. Littlejohn, thank you very much. That's your 3 minutes.
Thank you.
And we can go to Q&A after that. I believe the next speaker we have is Chloe Cole. Ms. Cole, you're recognized for 3 minutes.
Good afternoon. Thank you for having me here to speak. My name is Chloe Cole, and I am a detransition teen and a former transgender child from rural California. From the time I was 17, I've been traveling and giving my cautionary tale to legislatures across the country. I have dedicated my early adulthood to ensuring that no child in America and the rest of the world will be harmed by gender ideology and specifically cross-sex interventions, like the double mastectomy, cross-sex hormones, and puberty blockers that defined my childhood. I'm extremely grateful for the opportunity to have been a part of Tennessee's age restriction bills last year. However, The country has acted too slowly. Thousands have already been harmed. Half of the country is continuing to harm our children and young men and women. The number of people like me who are now realizing that they made a mistake is growing. And I'm excited to finally be able to advocate for my own demographic, the detransitioners. I'm 19 years old. I shouldn't have to worry about this. At 13, I had a healthy body. Now I live in complete uncertainty surrounding my health. I don't know what's to come for me. I don't know how much damage these procedures have done to my body. I don't know if I'm going to be able to have kids. When I got my blood testing done, I was given the male averages for hormones instead of the female averages as I requested. Doctors look at my mastectomy complications. They took skin grafts from my areolas that now leak clear fluid and sometimes blood. I have to wear bandages every single day to keep it from staining my shirt and my bedding. Doctors look at me and they just shrug. The experiment is never ending. I'm terrified. It's miserable to look down at my chest every day in confusion and uncertainty. Nobody deserves this. California, my home state, is not safe for me. They make it clear every time I walk into the doctor's office. All I know is gender affirmation, but I'm tired of being told that there's no way out for me. I'm tired of being told that I'm just on a gender journey. I'm done. My friends and I are creating a community to advocate for ourselves, and we deserve some real answers. We need to be able to come to Tennessee and get real medical care instead of the ideologically driven pseudoscience in California. Let's provide options. I'm grateful that you all have taken the courageous step to halt these harmful interventions, and the next step will be restoration. As it is right now, there is no gatekeeping to transition. The WPATH files that were released yesterday have proven that. I'm extremely grateful for the early detransitioners who have carved a path to move forward, and I'm working to continue that effort. And we need your legislative help.
Thank you, Chloe. That's our 3 minutes. Thank you so much, and we'll go on. Are you Miriam? Miriam Grossman, you are recognized. You have 3 minutes. If you could please make sure your microphone's on there and there'll be a red light pop up. Try one more time. Speak.
It's red now.
There we go. There we've got you. And if you could tell us who you are and again who you're with and what you'd like us to know, you're recognized.
Yes, my name is Miriam Grossman. I'm a child and adolescent psychiatrist, author, and a senior fellow at Do No Harm. Chloe is an extraordinary young woman. I'm sure you agree. Her strength to stand up and share her story is remarkable. But I want to point your attention to another way that she's extraordinary that you may not have thought about. Her courage to face the story behind the story we just heard. The process of admitting to herself and facing what must have been a very painful truth that she'd gone down the wrong path. The opponents to this bill say that people who regret their so-called gender transitions are extremely rare, they say, close to 0%. So this bill is not needed, they argue. I'm here to tell you they are wrong. A flood of detransitioners is coming. Just go on to the subreddit called Detrans. There are 52,000 people on there sharing their doubts and looking for support. A flood of detransitioners is coming. We must prepare to meet their needs, and this is what the bill does. You see, the current explosion of cases began about 10 years ago. We know that developing regret in many cases takes time It can take up to 8 to 10 years. Clearly, with Chloe, that wasn't the case. Everyone is different. But I want to explain to you, why does it take so long? Let's look at that process in a nutshell that these young people must go through. Agreeing to medical interventions in order to appear the opposite sex is the most consequential decision one can make, more consequential than your choice of college, career, where you're going to live, who you marry, and even whether to have children. When we make a life-changing decision, especially one that we have poured much time and energy and money into, and that also affects our loved ones, we cling to the conviction that it was a wise choice. That's human nature. At some point, moments of doubt creep in. They cause distress. So what do? We push them away. That also is human nature. But a tipping point comes, which is different for each person, and the doubts can't be ignored. They send a person into crisis and they have to deal with a whole range of feelings. Remember, these are kids who have underlying mental health issues, and they have to navigate family relationships, anger towards trusted medical and mental health professionals for misleading them, hostility and abandonment by the very community that was so supportive, enthusiastically cheering them on. Now they are demonizing them.
Thank you very much. That's our 3 minutes. Thank you very much for your comments. Sorry to stop you short there, but we have committee rules. Any questions or comments for the presenters? Representative Mitchell, you're recognized.
Yeah, thank you. Thank you, Mr. Chairman. I totally support this bill and giving you care. But I also support young people who needed the hormone treatment and other treatment last year, that I think you came and testified against those young people being able to get that treatment. So it's kind of curious to me that you're here today wanting treatment for yourself, but you didn't want those young people last year to have that treatment. And I'm just curious, I'm just going through here. You've testified in like 6 or 7 different legislators in the last few weeks. So are you here on behalf of yourself, or are you here on behalf of an organization?
Representative Mitchell, who's that? Is that addressed to anyone in particular?
Chloe Cole.
Ms. Cole, you're recognized.
I'm speaking on behalf of my experience as a patient, and I don't believe in denying anybody healthcare. I believe that anybody dealing with gender dysphoria deserves a better standard of care.
Well, Mr. Chairman?
You recognize Representative Mitchell.
Yeah, I got a little story. I had open heart surgery a few years ago, and after my open heart surgery, my doctor said, "Who's your primary care physician?" So I don't have one. I said, Minute Clinic. So my cardiac surgeon said, well, there's a doctor that comes out to the Bellevue Vanderbilt Clinic a couple of days a week. She has room for new patients. So I got those with her. Went to her probably a year and a half before I knew she ran another clinic at Vanderbilt the other 3 days a week. And she got so many death threats, her family, her children, herself, that she had to move from this state. And I no longer have a primary care physician. So I'm kind of a little upset with people now wanting health care for themselves, but for our young people, who many of them going through those problems, suicidal, how many people are they going to be harmed? So it really, I'm going to vote for this and support this, but you just think about those young people that they're now being denied care in this state.
May I say something?
Ms. Grossman, you're recognized.
Oh, thank you so much. It's Dr. Grossman.
Forgive me, Dr. Grossman.
Sure. Representative Mitchell, it's very important that you understand that the so-called gender affirming care that you're saying these kids need have no evidence of long-term benefit, none whatsoever. They have evidence of harm, but no evidence of benefit. And that's why Chloe and some of us travel around testifying against it. And that is why so many countries, Sweden, Finland, Norway, and Britain, and others, have done a 180, and they are no longer providing hormones and surgeries to minors.
Representative Mitchell, you're recognized.
We passed that legislation last year, and we didn't have one single medical professional speak on behalf of it. All we had was some radio personality that spoke about it. All I know is had many psychiatrists and therapists come before us and say the hormone treatment and some of those other treatments were stopping those children from ending their lives. So I don't care. You know, those parents were waking up, seeing their kid another day. And that's all I was caring about. And there wasn't any surgeries happening in this state. So no one can go on that little soapbox and say any surgeries were happening, because were no surgeries at Vanderbilt. So, I mean, I'm just like I said, I want you to have care. I'm voting for this. Think about those kids that have no care now.
Actually, Vanderbilt has admitted to doing these surgeries on children. There are videos out there of doctors there admitting to this. And I've spoken to many medical professionals, psychiatrists, physicians who are against what we are doing to children right now. And I think it's extremely irresponsible to speak about suicide in such a way, like it's an inevitability, because there is never any one reason that anybody commits suicide. It takes a lot of failures and pain in one's life to get to that point. And by speaking about it like it's inevitable, it will end up creating more suicides.
Okay. We're going to wind up this line of questioning. Representative Mitchell, last point.
Yeah, and please do not call me irresponsible. I'm doing the best I can to provide as much care for all Tennesseans as I can in my state. I don't travel around the country putting on a story across the country. You know, it costs a lot of money to go from state to state to state to state. And you're doing this on your own.
I'll have the committee members realize we are hosting individuals here who have come of their own free time and want to talk on this legislation. Chairman Williams, you're recognized.
Thank you. Ladies, thank you for coming today. I appreciate your testimony and your advocacy for people like you. I will say I can't apologize for anybody for their lack of empathy or their own personal experience, but I can thank you for yours. And so even though this committee, if I were in charge, I wouldn't make sure that anyone disrespected you or your sacrifice to get here. And I think it's important for you to hear and know that. The purpose of this bill today is not to talk about what happened in the past or whether it was a top surgery or a bottom surgery or whether it occurred or it didn't occur. The fact of the matter is there are hundreds of kids across the nation, maybe thousands, I don't know, who are experiencing exactly what you're experiencing today. And I can appreciate the pain, the suffering, the lost sleep at night, and everything that you're doing. But you are right. If we can provide services to someone to further complicate what's going on with them both mentally and physically, we can provide services to them to help remedy the situation so that no one, regardless of their political view, is isolated in such a way that they feel like they have no hope or help, regardless of which side you are on this issue as it relates to whether you support or do not support it. But we should provide every resource necessary to make sure that if you choose a different path than the one you started at, of which most of us have in our lives, that you get the empathy, the support, and the encouragement you need to make sure not only that you get the help you need, but also ensure that others around the state and nation understand and know the implications of the decisions they make, even as a minor, even if your parents or family may support it. So I appreciate your courage today. I appreciate your advocacy on behalf of those faces that we don't see, and you giving of your time to be the face of those that are in our community today. So thank you for being here today.
Thank you, Chairman Williams. Chairman Williams. Chairman Leatherwood, you're recognized.
Hi. In response to some of what I've heard regarding inconsistency, I believe testifying against something, a procedure that does harm, and testifying in favor of procedures that would undo that harm is very consistent. And I appreciate your courage and your consistency in testifying today. Thank you.
Thank you very much. All right, Representative Sherrill, you're recognized.
Thank you, Chairman. Thank you, ladies, for being here today. Just may not fully understand all this. And you're from California, is that right?
I am.
Okay, Ms. Chloe. In your experience, what you're experiencing today, did this start in California?
Yes.
Okay. So did maybe the doctors in California maybe give you some bad advice, or somebody give you some bad advice in California?
Yes, but this is being the standard of care is being followed universally across the states.
Okay.
So this has happened in Tennessee as well.
Okay. So maybe some things that happens in California maybe don't happen in Tennessee. I mean, we do believe a little bit different in Tennessee how they do in California doing things. It sounds like a very bad situation, what I can understand about it, but just sounds like somebody has give you some bad directions in life or where you're at today. But I am, what can we do to help in these situations? I think that's something that we need to look at, because you're not the only one that's dealing with what you're dealing with today. So what is the best solution? I don't know for fully, but I know we have people that has some very sad, sick situations in life, and God help us, because we definitely need Him. Thank you.
Thank you, sir.
Thank you. Any responses from anyone at the table? Yes, ma'am. Ms. Littlejohn, you're recognized.
Thank you. I just want to be clear about something as a parent who has experienced this firsthand with their child. This is a mental health issue with underlying root causes. And I am so grateful to see that you have outlined in this bill therapy that parents can choose, because that is now the treatment of choice after other countries, including Florida, have done systematic reviews. The truth is, Representative Mitchell, is parents are being lied to, and cutting the breast off of 13-year-old girls is not suicide prevention. Thank you.
Thank you. Thank you all very much for your testimony. We appreciate it. Thank you so much. We have one more individual who has requested to speak. Is there Darren Johnson? Excuse me, Darren Johnson. If you could please come to the table, tell us who you are, who you're with, and what you'd like us to know. You have 3 minutes from the time you begin. Please introduce yourself. You're recognized.
Chairman Hawk and members of the committee, thank you for allowing me time to offer perspective on HB 2816. I am Chaplain Darren Johnson, a 20-year resident of Davidson County. On first blush, the summary language of HB 2816 makes it seem almost innocuous. Indeed, is something with which many of us would agree. People should be able to access, and insurance should cover, the health care they, along with their providers, feel will best benefit and support them. Such sense of shared concern, though, disappears quickly. For while the summary states the data to be collected is only about a certain type of care, The specifics of the bill requires providers to hand over a broad and invasive set of healthcare specifics for a group of patients that, even with all the definitional details listed, the bill leaves suspiciously vague. Just how broad of a group will this really target? For providers, these are just some of the ways the bill appears to set something up just to trip them up. The legislation is inconsistent in what it mandates and is onerous, requiring details all the way down to the ways that my prescriptions are administered. These problems are amplified because the same requirements are almost verbatim put on insurers as well. Additionally, I'll note that while the bill states that neither clinics nor insurers shall include individually identifiable health information, when one actually looks at those definitions in 45 CFR 160, it would appear almost impossible to comply simultaneously with both the state reporting mandates this bill requires and federal protections regarding appropriately safeguarded IIHI. This paradox is even thornier when realizing that the CFR includes a clause that marks as protected not just information by which one can be directly identified, but also that information from, quote, which it is reasonable to believe one can be identified, end of quote. Given the sweeping detailed data this bill requires to be collected, it would be reasonable to believe that one could be identified from that alone. Then there are the serious data privacy and information security concerns that come from any unique set of data. And they are heightened in this case because of the mandatory reporting of this information to both speakers, the state archives, and a public-facing version. Beyond this, if one considers the animus the state has shown with which it is willing to act towards patients, persons like me and the rest of our community, then it seems not only reasonable to believe one could be identified, but in fact will be. It is for these reasons and many others besides that I urge you to vote no on HB 2816, an inconsistent, onerous, costly, and quite frankly, dangerous bill.
Thank you very much for your comments. Any questions of the presenter? Thank you very much. We are back in session. Any questions or comments of the sponsor? Chairman Jernigan, you're recognized. Then we'll go to closing comments to Chairman Faison after that. Chairman Jernigan, you're recognized.
Thank you. And actually, mine is for legal, if we could go out of session for a moment.
We're back out of session.
Sorry.
Ask your question, then we'll introduce legal staff.
Great. Yeah. So we put an amendment on there, the right to legal restoration. And it talks about how we're going to set up a process in order to change back in collaboration with the Safety and other state records department shall develop an expedited process to change the sex, name, pronouns, certificate, driver's license. But I guess my question is, have we not already passed where you can't change your birth certificate and you can't change your driver's license? Did we pass that already? And
Ms. Miller, if you could introduce yourself, tell us who you are, who you're with.
Caroline Miller, Office of Legal Services. I can look at that for you. I'm not sure off the top of my head.
Okay, that's what. If you look it up,
Sure.
that'd be fine, and we can go back out of the session. I guess that's fine, but we're back in session, I guess, so I can. Well, I'll tell you what. You need to have a question for? All right.
Any questions more for legal while we're out of session?
Yeah, thank you.
Chairman Terry, you recognized.
Thank you. So we have statute for intrauterine termination of pregnancy that protects HIPAA and private information that it's de-identified. The way that this bill is drafted, are these individuals de-identified or required to be de-identified?
Recognize Ms. Miller.
I don't think they're required to be identified, but to the extent they would need to be de-identified to comply with the statute, and federal regulations, then yes, they could. There's nothing preventing them from being de-identified. If they can comply with the requirement to produce all the information on the forms without de-identifying the information, I guess they wouldn't be required to. Does that make sense?
As this bill is drafted, are we going to be violating somebody's private health information to directly identify them?
No, I don't believe so. I mean, any information produced must not contain individually identifiable health information.
Thank you.
For the questions of legal while we're out of session. We'll go back in session. Chairman Faison, did you have something to add to that conversation?
I did, and I just texted safety, and I think moving forward, we might want to reconsider action and take the amendment off the bill based on the question that I just heard. And I just texted safety, and they agreed.
Okay. Chairman Jernigan, I think you've heard the suggestion by the sponsor of the bill. You recognize Chairman Jernigan?
Well, yeah, thank you. I would just think, I appreciate that, because if they're not allowed to do it, then where are they going to change back to? So I'll leave it to the sponsor and so I would make a motion to reconsider our action on the amendment.
All right, thank you.
If the sponsor considers it friendly.
We have a motion to reconsider our action on amendment drafting code 013789. We have a second? Any discussion on the motion? This vote will be to reconsider our action of placing amendment drafting code 013789 on the bill. Consideration will be now to remove that amendment from the bill. All those in favor of removing this amendment language from the bill, please signify by saying aye. Aye. Any opposed, please say no. House Amendment number 1, drafting code 013789 is removed from the legislation. We are back on the bill in its original form on original bill, House Bill 2816. Do we all understand the posture where we are at the moment? Thank you very much. Representative Sherrill, you're recognized.
Just one question. Is this asking for funds from the state to do what they're asking for?
Chairman Faison.
Thank you, Mr. Chair. This is not asking for funds from the state. This is saying if you have covered and you're part of the state plan, you've covered that you're going to pay also to detransition them. Is there a potential that state funds will be used? Absolutely.
Thank you.
All right. Any closing comments, Chairman Faison?
Mr. Chair, the bill does 4 basic things, and I don't know if we ever hit it, and I felt maybe I should at least mention the 4 basic things that this bill does with your indulgence. I won't take but a minute. The first thing it does, that it ensures the right to transparency. Secondly, ensures the right to insurance coverage. Third, ensures the right to mental health care. And fourth, ensures the right to legal restoration. And this does not handle private insurance. This is only the insurances that have contracted with the state of Tennessee. I would love to see our state eventually get to a place that we do say, if you paid for transition surgery, regardless if you're government issued or not, that you'll pay for it to go back, but we're not there yet.
All right, ladies and gentlemen, you've heard the explanation of the bill. Are you ready to vote? All right, all those in favor of sending House Bill 2816 unamended to full health committee, please signify by saying aye. Aye. Any opposed, please say no. The ayes have it, your bill moves forward. All right. Thank you all very much. We are now back on House Bill 1682. Representative Martin is back in the room. Item number 8. If you could turn to our calendars, we're going to go back to item number 8 on our calendars, House Bill 1682.
Motion.
We have a motion. We have a second. You are recognized, sir.
Thank you, committee and chair. I have an amendment as well that rewrites the bill.
I think we have an amendment that has been been worked on by leadership on the committee. We have amendment drafting code 014768. You have a motion, you have a second. Let's go ahead and put the amendment on the bill as we discuss. All those in favor of placing amendment drafting code 014768 on the bill, please signify by saying aye. Aye. Any opposed, please say no. The ayes have it. Your bill is amended and ready for discussion, sir.
Thank you, Mr. Chairman. This is administrative bill from the Department of Mental Health and Substance Abuse. If y'all recall last year, we passed Public Chapter 199, which clearly defined qualified advanced practice providers, licensed advanced practice nurses, and physician assistant under that title. This administrative bill would expand upon that, which would allow a qualified advanced practice provider to complete one of the certification of needs, along with a certificate of need completed by a physician for the probable cause and judicial commitment hearing, which is determined if a patient would need extended hospital stay. This amendment that we added would allow qualified advanced practitioner to sign one of the certificate of needs as long as the qualified advanced practitioner provider is not under a collaborative practice agreement with the licensed physician that signed the other certificate of need. And this legislation would better deliver the services to the people of Tennessee by increasing the available mental health workforce who can compete a certificate of need for commitment proceedings. With that, I stand ready for a question.
Thank you for that explanation. Chairman Terry, you're recognized, sir.
Thank you, Chairman. Thank the sponsor, and I want to thank you as well as department for working with me on the amendment to get the language in a posture of where we are. You have two different entities that are still going to be signing that second certificate of need, and so thank you guys for working with me. That's the way this process is supposed to work. So thank you.
Thank you. Appreciate the collaboration and the calls over the weekend that we were able to get to ensure we were going forward with this legislation. Any further questions or comments of the sponsor? You ready to vote? All those in favor of sending House Bill 1682 as amended to full health committee, please signify by saying aye. Aye. Any opposed, please say no. The ayes have it. Your bill moves forward. Thank you. All right, Chairman Leatherwood, thank you very much for your patience. I know we jumped ahead a little bit there. We are back on item number 15 on our calendars. Item number 15 on our calendars is House Bill 2004 by Chairman Leatherwood. Do we have a motion? We have a motion. We have a second. You're recognized, sir.
There do have an amendment for the bill.
All right, looking at amendment drafting code 013893. Is that accurate, sir?
That's correct.
All right, you have a motion. You have a second. Let's go ahead and put the amendment on the legislation so we can have full discussion. All those in favor of adopting amendment drafting code 013893, please signify by saying aye. Aye. Any opposed, please say no. The ayes have it. Your bill is amended and you're recognized on 2004. Chairman Leatherwood.
Thank you, Mr. Chairman and committee. Somebody just made note. We've got 5 minutes left. 5 minutes. I've got two bills. I've got confidence in us. They're both simple, easy. This bill just directs the Department of Health to investigate the frequency of cases of cancer and Parkinson's disease in Murray and Lawrence County, where residents there feel like there's an inordinate number of these cases. Just has Department of Health look at the information that they already have actually and compile that and report back. So I appreciate y'all's support.
Question has been called. Seeing no objection. All those in favor of sending House Bill 2004 as amended to full health committee, please signify by saying aye. Aye. Any opposed, please say no. Your bill is amended and moves forward.
Thank you.
All right. We are now on item number 16, House Bill 628. You are recognized, Chairman Leatherwood, on House Bill 628. You have a motion?
Motion.
We have a motion. You have a second. You are recognized, sir. And we may be in a posture to have an amendment. We have several amendments on this, and let's see which one we're going to go with here, sir.
Okay. There are actually 4 amendments listed, and that just shows that how much work has gone in with all the stakeholders to come up with just the perfect bill. We're going with Amendment 014612.
Motion.
All right. We have a motion. We have a second. Ladies and gentlemen, if you'll look at your packet, it is amendment drafting code 014612 after an abundance of work by numerous people. We have a motion. We have a second. Let's go ahead and put the amendment on the legislation as we move forward for discussion. All those in favor of placing amendment drafting code 014612 on the bill, please signify by saying aye.
Aye.
Any opposed, please say no. Your bill is amended, and you are recognized for explanation on House Bill 628.
At the recommendation of one of my colleagues up here, I will try and be less verbose. It's a great bill. I appreciate your support. With that, I'll take questions.
Less verbose is what I heard. And thank you. We have had a long committee meeting, and I appreciate that. This is very important to our physicians across the state of Tennessee, those who may have been suffering from a particular issue during their careers, and is going to be very helpful to folks. Chairman Dr. Terry, you're recognized.
Thank you, Chairman. I'd like to thank Vice Chair Leatherwood for bringing this piece of legislation. It's incredibly important for the medical field. In fact, last month when I was at one of our ASA meetings, had the head of the AMA, who is also an anesthesiologist, Dr. Ernfeld, give a talk, and part of that was dealing with burnout, physician burnout, and just some statistics off this study is that 2 in 3 physicians have experienced burnout, and 1 in 5 plan on leaving medicine within 2 years, and 1 in 3 plan on reducing their hours. And nearly half of the physicians in the U.S. are, I'm not going to say the age, but they're my age or older. And so that's quite concerning. And so helping our physicians deal with this issue is of utmost importance. So, and I fully support this bill.
Thank you very much. Any more verbose comments on the piece of legislation? Question has been called. All those in favor of sending House Bill 628 as amended to full health committee, please signify by saying aye. Any opposed, please say no. Your bill moves forward. House Bill 628 moves forward to full health committee. All right. We have disposed of item number 17 on our calendars. It looks like we are unfortunately rising up against the clock here. We are on item number 18 on our calendars. Item number 18 by Representative Powell. The request has been from Representative Powell to roll this bill for 2 weeks. House Bill 1960, rolled 2 weeks without objection. We have less than 2 minutes to go. I don't know if we can do justice to Representative Johnson's piece of legislation in the 60 seconds that we have now. My apologies for not being able to get to the legislation. What we will do, the rest of the calendar will all remaining bills that we were not able to work on today will be rolled to the next calendar without objection. And seeing no objection, we are adjourned.